Hey, good morning. This is Dr. Bob McIntosh, Health Source Chiropractic. I wanted to touch base. I've got great news for you guys. I have some treatments that I have been thinking about. How do I communicate and how do I get you guys more information to be able to share what we do, how we do it, those types of things. And a lot of people are familiar with chiropractic, with manually adjusting as far as neck, mid back, low back. And I wanted to touch base on some of the other things that are out there. And so what I'm going to do today is, as I walk through the office, I'll just give you a guide around the office, but then I'll show you one of the tools, and I'll just pick a tool and show you how I use them and what I do. So here we go. Let's go have some fun. This is our waiting area, which we minimize as much as possible. Sometimes they're a little busy, but we try to get caught up as quick as possible. But here's our rehab area. This is where we do a lot of our functional rehab to be able to create strength and stability in keeping people better so they don't have injuries down the road again. So that's what we do. We have a certain type of table here. It's called a flexion distraction table, and I'll have to show you that at another time. But we, let's see here, go on down the way here. We're gonna go down to our x-ray suite and turn this on, get this set up. I'm gonna tip this down just a bit too. Okay. So a couple of things. This right here is a spine, and then I have this is a spinal board here. So a spinal board is something that I utilize to be able to help separate some joints in the spine. And so when I took and I learned to use this, it was probably about four years ago, and it's used for acute back situations like lumbar disc herniations or even facets that are just on fire, and I'll tell you what those are anatomically here soon. But you'll have someone lean forward and they've got pain, or lean backwards and they've got a lot of pain, but standing upright they seem to be okay. They're just kind of sore, but you take them to those ends of motion and they're just starting to hurt. The spine is interesting. It's very complex, and it has individual segments as far as a bone, and then this white or this kind of clear portion. This is the cushion or the disc. So it goes bone, disc, bone, disc, bone, disc. And you have three curves in the spine. One forward in the low back, one in the mid back curves this way to the back, and then to the neck curves this way. When you have the three curves, you have a shock absorber to the spine, and it can take wear and tear. And I can tell you, as far as when I take an x-ray, and in this suite right here, what we do is we'll take x-rays on neck, mid back, low back, whatever is necessary, because we have the tools to be able to serve and evaluate your spine properly. So what happens is I see a lot of spines that either are in their low back don't have any curvature, a lot like this, or they've got too much curvature in their mid back and they're humped up, leaning forward, and they've got neck problems, or this can cause low back problems. So what'll happen with these patients that, let's talk about the joints here, with the pain in their low back. So this is the bumps you feel on your low back. Here's the hip sockets, here's your pelvis when you put by your waistline. This is what you feel up on the side, and these are the bumps on the back of your spine that you feel. And so what happens is, on the back of the spine here, you can see these little joint spaces right here. There's not a lot of movement, and it's only like single digits as far as range of motion that each of these can move, and not even very much in rotation, but in the low back it's forward and backwards. So when I have someone lean backwards and then lean forwards and they are hurting when they go backwards, they're pinching the joints on the back, okay? And it can be the joints, it can be the disc or the cushions, it can be a herniation. If it's pushing the disc even further out, it can be causing pain going down the leg when they lean backwards, but it can also just be localized. And so what ends up happening is I gotta figure out why they're not moving properly. Like, what's in the way? What tissues? Is it the joints? Is it the cushions? What is it? And so I can take this board and have the person lay on it, and then bring their knees up to their chest, like this, and I can tip the pelvis like this, and then when I do that, I'm gonna set this right here. when I do this, it creates a separation and gaps those joints down here on the back, and then I can take and use our drop table, pick this up, and then drop down through it, so it'd be just like this. Tip up, and then down through it, and create motion or a shearing effect to be able to loosen up those joints and to stop irritating the joints on the back of the spine. So I have patients that'll stand up, go and touch their toes and lean backwards and have zero pain after that. Now a lot of the questions are, all right, that was quick, that was amazing, I just don't know what to take from that. And so what I try to tell every single person is, I will not lie. Sometimes I'll have an adjustment within 1 or 2 adjustments, and they'll be perfect. And you throw high fives when that happens. But normally what happens is those joints start moving little by little as you start to adjust them more and more and more, and increasing mobility, breaking up that scar tissue, and improving the health of the joint. So that's what I do. That is called the spinal board. Okay, I utilize spinal boards for people that can't handle on their side adjusting and creating a lot of rotation in their low back. There's even some studies that talk about you need to create stability in the low back and then mobility in the pelvis and in the mid back. And so I'll create mobility in certain motions in the low back, but really work on that mid back hump. And what happens is they start to sit upright more, and it reduces the low back pain. And so when I go on site and test employees, I test them if their jobs are a seated job, they tend to lose a lot of that extension motion. That's why I do posture videos, things like that, for you to be able to understand this. But ultimately, we've got to create mobility in the joints. Some can't overdo it. We've got to be able to create a healthy amount of mobility, but then strengthen and stabilize everything around it so you can stay better and feel better longer. So it's Dr. Bob McIntosh. That was a spinal board. That's how we utilize it. I can create that motion. I'll even try to dig in deeper and show you in more details exactly what I'm doing. I'll even try to do it with a patient sometime and show you what I mean. So hope you have a great day. Low back pain is our focus for this week. If you know somebody with low back pain, with a disc problem, with a facet problem, with an SI joint problem, I can most often help, and if I can't, I'll get them directed to where they need to go. So thanks for watching. Have a great week.